Hi, I'm Kelly at North Shore Eye Care. I'm sitting here with Dr. Martin, and we're going to talk about dry eye and some of the subtle signs that people may not even be aware indicate dry eye. Hi, Dr. Martin.
Hi, Kelly. So, what I'm going to talk about today is some of the more subtle signs of dry eye and what we see every day in the lane as we examine our patients. So, as you know, I do a fair amount of cataract surgery and laser vision correction here in the practice, and one of the things that I often have to work with is dry eye. So as we get older, all of our ocular surfaces start to get drier. Specifically, postmenopausal women, as their estrogen drops, their eyes get dry, their mouth gets dry, their skin gets dry, and this is something that they don't necessarily know, but it's a huge eye problem that we deal with on a daily basis. And when we do any type of ocular surgery, the ocular surface can get drier temporarily, even if it's a fantastic 5-minute cataract surgery. The ocular surface can get drier and can create some vision irregularities afterwards. Some of the symptoms of dry eye that we see that people don't necessarily correlate with dry eye. People correlate their eyes feeling dry, burning, tearing, itching, foreign body sensation. That they know is dry eye. But some of the findings of dry eye or some of the symptoms are less obvious. For instance, one thing that we see in dry eye in many patients is blurred vision while reading. So when we're doing a task where we're concentrating, like reading a book, watching a movie, or watching TV, driving a car, sometimes when you're concentrating like that, you'll blink less. So patients will come in and say, after I read for 20 minutes, the page starts to get blurry. I have to blink a few times and clear it up. And what that is when you're reading and you're concentrating, you don't blink as much. The tear blink rate can go down from, let's say, 12 times a minute down to maybe half that. And when that happens, the eyes start to dry out over time. Another thing that we see when it comes to dry eye is just fluctuation in vision. So it'll be clear and then it'll be blurry, and then it'll be clear and then it'll be blurry. And that's something that we see quite a bit with dry eye. So the way that treating dry eye is a very complex process, and in many eye offices and eye care providers simply treat dry eye with some over-the-counter tear drops. But there's a lot more to it, a lot more available to us that help people with dry eyes. For instance, Restasis is a medication, prescription medication that helps many people with dry eye. It's topical cyclosporin, and it stabilizes the tear film and reduces inflammation, because a lot of what dry eye is based in inflammation. So we have Restasis, we have punctal plugs, little plugs that we can place in the tear drainage canal of the eye so that the tears stay on the eye longer.
Is that done in the office?
It's done in the office, very simply, covered by insurance, easy to do. We have nutritional supplements, omega-3 fatty acids, which are good for dry eye, dry mouth, dry skin, and even can be helpful with heart problems that postmenopausal women can develop from a decrease in estrogen. We also talk a lot about environmental triggers, scented candles, soap, shampoo, detergents, fabric softeners. Any of these things that are heavily scented can be very irritating to an ocular surface that's dry or inflammatory. So these are all the things that we go over with our patients when they come in for an evaluation and we discover dry eye. And many of these patients don't even know they have a dry eye. They just think they have poor vision. Right.
So how long does somebody usually have to, I guess it's case by case, but surgical patient might just need to treat dry eye for a short period of time, as opposed to somebody who's just older and it's become part of them now? Right.
So we always look for dry eye preoperatively in our LASIK patients. And when we see it, sometimes we'll treat preoperatively. And if it's not that bad or the patient's asymptomatic, sometimes postoperatively we'll watch them a little more closely. And if they develop dry eye symptoms, then we treat more aggressively. But that treatment post-surgery usually lasts about 4 months or so before they come back to baseline of where they were before.
And what kind of testing? I know here we have the latest and most advanced technology, so what kind of testing is done to detect?
So there's some great tests that are more objective when it comes to dry eye these days. Of course, we have some of the older tests like Schirmer tests where we put a little paper strip in the corner of the eye and see how it fills up with tears. We also have the Tear Lab, which is a great new innovation in dry eye, which tells the osmolarity of your tears. So what it does is it tells you the saltiness of your tears. And a dry eye has less fluid, so more salt. And so the osmolarity will be higher. If the eye is of normal osmotic concentration, there's more water in the tears with the salt. One other finding in dry eye that patients don't realize is dry is tearing. So many patients that actually tear have dry eyes because when your eyes are dry, your fifth cranial nerve that innervates the cornea gives a message to your brain to turn on the lacrimal gland and create all these watery tears that don't really help because you need the thicker substance of the tear film. And so people come in and say, I don't have dry eyes, they're wet. Look, they're tearing right now, which of course is a sign of dry eye. So that's another thing that's a big misunderstanding when it comes to dry eye. And there are other tests out there now when it comes to dry eye, point-of-service tests that help us to evaluate how dry an eye is and whether the treatment's working or not. So the nice thing about tear osmolarity is that you have a number to go by, and as the tear film gets better and the eye gets less dry, the number should go down. And so we use all this technology to help treat our patients the best we can.
Great. All right. Thank you.
Thank you.
If you would like to schedule an appointment and come in and meet Dr. Martin or any of our wonderful doctors, please call 631-265-8780, or you can also check out our website, nseye.com. Come in and have some tests done if you think that this might be something that's concerned for you. Thank you.